Okay, so suppose we have a Maryland bridge. This was the case, the student was cementing Maryland. So this is the Maryland, and these are the metal wings around. How am I going to clean the proximal areas from the cement here? It's very critical to keep the interdental papilla, because we want to build also interdental papilla. So both this has been extracted for a very long time. I want to come with the contact in the, I want interdental papilla to build here. Okay. First of all, it should be clean from any remaining cement. Secondly, I should design the contact area here depending on the X-ray of the bone. How much crystal, supracrystal space can support an interdental papilla? What is the dimension?
2.
No, 5 millimeters. 2 millimeters is the biological width. But I'm not talking about, I'm talking about the contact to the crest of the bone. You can see it on X-ray. So after you finish, if I take an X-ray for this, for interdental papilla to build in, because gingiva has a property of growing into spaces, empty spaces. If the space was supported by the alveolar bone, the alveolar bone will allow and support our interdental papilla. So this is why we need to clean the cement after cementation in the Maryland bridge. So the design of the contact area should be 5 millimeters away from the crest of the bone. So if you take an X-ray before you do your Maryland, you design where you want your finish line, and you tell the technician where to place the contact. Okay. Now the second thing is cleaning the cement. How do we do clean cements after we have cemented? Multiple techniques. First of all, I wait for the cement to become in a gel stage. Okay? I don't clean it while it's wet, because when it's flowable, still flowable, when I try to wipe it away, it will create thin sections. I don't want that. Wait until it's in the gel stage. What do I do in the gel stage? I begin flicking it away from the tube, okay, by a probe or something like that. This is the stage where also I use a floss. So wherever I have a bridge, always cement a bridge with the floss in here, okay? Definitely away from the cement, because I don't want it cementing and adhering to the cement. But the floss is there, okay? 2 flosses are there. With the floss, I begin flossing in the area of the cement. When it's in the gel stage, I begin flossing in between and dragging this. I don't want to take the floss out vertically. Rather, I drag it and slip it away in between the teeth. I do a rotation movement, a spiral movement, and drag. Spiral movement and drag. It will take out the cement with it, okay? It will drag the cement particles with it. And this floss also here to concentrate on this side, because I want to drag around this, so it clean the cement from this margin, and it clean the cement from this margin. Okay? So always floss after you cement, under bridges, under the pontic. If you don't add or you forgot to place a floss, then you have to have the super floss that we do under bridges. You remember, it is a regular floss. It has an area with a sponge with it. This is excellent, and it has an area that's waxed. This is you feel it like hard. It's not pliable. This waxed side, it will act like a needle. So I enter from here, I could hold it and take it out from here. The sponge in the middle is very good in cleaning the cement. Okay, super flosses are excellent. But if you don't have a super floss, always remember to cement the bridge, place 2 flosses beneath it, then cement. And when it's in the gel stage, begin flossing with the flosses, moving them around and cleaning the areas. And don't drag them vertically, drag them sideways. So you drag them, you do a spiral motion cleaning, and you drag. You do a spiral motion cleaning and drag. So while you're dragging, you're cleaning and taking out the debris. And then finally, I check with the final. I check with my probe. I should check that I don't have any remaining cement. And finally, if it's hard, it became hard, I come in with very thin minimal dentistry. Do you remember the bears for minimal dentistry, how thin they are? Very thin finishing bears. They are specific for cleaning cements on the margins. Okay, you need that kit for cement cleaning bears. Okay, it's preferred not to use them at all, because the vibration from the bear can fracture some of the cement. But if you need it, you should have these very fine bears. They are very thin and short, very thin and short, and with a very fine grid. They do a polish and trimming as well. So you run them around the margins of your preparations, or cement, or crowns, or mirrorlands, or whatever. Okay, so make sure that you're totally clean of cement. Maybe the crown is perfect, but excessive cement or remaining cement will cause periodontal disease as a bad crown would. The same thing. So removing cement is essential. Thank you.